President Trump's so-called One Big Beautiful Bill made big changes to our health and health care safety nets, specifically to SNAP, what used to be food stamps, and to Medicaid, which provides health insurance for low-income people. The funding cuts the bill calls for are just starting to kick in. We check in on what's happening so far with both programs on today's Story of the Day.
Support for Story of the Day comes from the Devlin Inn and Suites, Lake Placid, welcoming families, athletes, and groups to the Olympic Village, offering Adirondack Mountain views and dog-friendly accommodations. TheDevlinNY.com.
Hey, I'm David Sommerstein. It's Wednesday, March 25th. First up, healthcare providers in New York are clamoring for more money as part of the state budget. As the New York Public News Network's Jimmy Vielkind reports, nursing homes are competing with hospitals for a slice of the funding pie.
How are you, Paul? Very good. How are you?
Everyone in the lunchroom of the Kingsway Arms Nursing Home in Schenectady knows Jamie Farnan. He runs the place and says employees stay in their jobs for decades. Farnan says that's the key to its quality, but without a bump in state funding, the longevity and the care it supports are at risk.
My magic wand would revolve around having enough resources, human resources, to do this and to provide the level of service that we need.
Nursing home leaders are pushing New York State to increase their funding by boosting how much the Medicaid program pays for care. Medicaid patients make up more than half of Kingsway's residents, but the home loses money on each one.
Really, you have this perfect storm with nursing homes and long-term care in New York.
That's Stephen Hance. He leads a lobbying association for nursing homes.
Medicaid needs to cover the cost of care for that resident, to provide nursing home resources, to compete in the labor market, to recruit and retain those workers, invest in their buildings, and then we will begin to right the ship in New York State in terms of long-term care.
Governor Hochul is proposing an additional $1.5 billion, split between nursing homes and hospitals. State lawmakers are arguing over how to divide that money. Nursing homes want at least half. 10 facilities have shuttered in the last 2 years, removing more than 1,000 beds from the system. State Senator Pat Fahey said at a rally that the latest closure is in her Albany district.
We lost yet another nursing home. Part of it was a dated facility, but all of that comes down to funding as well. So we are feeling the squeeze. I appreciate.
But there's stress throughout the healthcare system. A hospital chain in the North Country, near the Canadian border, recently declared bankruptcy. Other rural facilities are reducing their services. Ken Rasky leads the Greater New York Hospital Association. His trade group says the federal tax and spending bill, which Republicans passed last year, will cut $8 billion from hospital coffers. Several 100,000 New Yorkers are expected to lose health insurance because of that law.
When they lose insurance doesn't mean they don't get sick. And when they do get sick, we still take care of them. That becomes uncompensated care.
And uncompensated care is eventually covered by taxpayers.
It's $11.99 in the house.
Governor Hochul rallied with Rasky and unionized healthcare workers. She blasted the federal changes and says she's committed to protecting healthcare jobs.
That is a fight I'll join all of you with any day, anytime, anywhere. But also, I have confidence that this budget will deliver the relief you need, that healthcare workers need, that our patients need. Because
Hochul's aides say they'll work with lawmakers to divvy up her proposed funding increase. Assemblymember Kerry Warner says nursing homes are a key part of the system. Without them, patients can get stuck in hospitals even when they're well enough to leave. And that's even more expensive.
Making sure that there is a path when somebody is ready to be discharged into a nursing home means that hospital isn't going to experience the uncompensated care. And uncompensated care, by the way, just ricochets back on all of us.
State budget talks are continuing until the March 31st deadline. In Schenectady, I'm Jimmy Vielkind for the New York Public News Network.
Starting this month, more people will need to meet new work requirements to stay eligible for the Supplemental Nutrition Assistance Program, or SNAP, what used to be called food stamps. The changes from the Big Beautiful Bill Act will reduce SNAP funding by about $186 billion over the next decade. About 85,000 people in the North Country use SNAP benefits to pay for groceries. Our news intern Richard Haller breaks down what these changes mean for people who rely on SNAP to keep food on the table.
In St. Lawrence County, Canton's Neighborhood Center has a food pantry where over a dozen people visit a day.
And they can get vegetables and fruits. And then over here is the grains.
Director Mia Benjamin shows me around the pantry. Shelves are stacked with canned goods, bread, and there's a fridge packed with meat.
And then this shelf right here is a free shelf. This is kind of like snack foods and things. We have a lot of homeless that come in. And because they're on the streets, they don't have can openers, they don't have microwaves. They mostly eat from that shelf right there because it's easy for them.
41-year-old Cassie Shannon is packing up boxes of food and handing them to people who walk through the door. She volunteers at the pantry 30 hours a month. It's part of her work requirements to stay eligible for SNAP benefits.
I have to do job search. I have to go to classes online. I have to come and do work fair every week. Any classes that they want me to provide over at the One Stop Career or anything like that, I have to make sure I do. And one thing that I don't do, they will sanction me off. So,
meaning cutting her SNAP benefits. Shannon is a single mom. She says she relies on them for groceries.
It does help out a lot because when you can come to a pantry and only get a box of food every 2 weeks, it doesn't supply a 2-week supply of food, really. So it does help having that $180 or $200 in food stamps a month, for sure.
More people are going to have to work longer hours to keep receiving SNAP benefits under the law passed last year. People who used to be exempt, like veterans, homeless people, young adults aging out of foster care, and older adults ages 55 to 64. Starting in June, they'll all have to work to keep their SNAP benefits. Lindsay Merman, the Clinton County Deputy Commissioner of Social Services, says that they're training staff to implement these new changes so that they can help people keep their food stamps.
We're really focusing on making sure the clients understand the requirements, that they understand the possible exemptions, and that we're connecting them to, the tools and resources that are needed really to maintain their eligibility.
Merman says that in Clinton County, around 1,500 people now have to find work. She says if they don't, they'll lose their SNAP benefits.
I think there's a potential higher risk of food insecurity or housing instability. You may have somebody who is choosing to put food on their table over paying their rent.
Over the past year, the Trump administration has made rapid changes to social safety net programs like SNAP, also Medicaid and Social Security disability. Meanwhile, electric bills and gas prices have been going up and straining people's budgets. Roger Figueroa, who researches food insecurity at Cornell University, says that he's concerned these cuts to SNAP will just make it harder for people already struggling with affordability.
Food insecurity has only worsened since the COVID-19 public health emergency. Right now, the rate is at 13.7 prevalence rate for the U.S. population, and it's about 18 million people. And that prevalence rate is the highest in the last 6-7 years. So we're disinvesting in our population health.
Figueroa says that while these federal programs are being cut, community centers and food pantries fill in the gap. Cassie Shannon at the Community Neighborhood Center in Canton says there's only so much they can do.
So what are the families supposed to do with no food stamps if all these neighborhood centers and food pantries can't afford to feed everybody that's not going to have food? It's already hard to supply families, let alone more people off poverty having no food stamps, so it's just going to be a wreck, I think.
Work requirements have already kicked in this month. People who can't fulfill them will be removed from the SNAP rolls in June, with a 3-year waiting period to reapply. For North Country Public Radio, I'm Richard Haller in Canton.
Hey, how about that intern, Richard Haller? Such incredible work, such mature journalism from SUNY Canton. Way to go, Richard. We have more news all the time on our website, ncpr.org. Music today by the Saranac Project of Saranac Lake and Ben Sharon of Watertown. I'm David Summerstein, North Country Public Radio.